Hello, I'm Bruce Lorenz, and this show is called Bruce on the Loose. I talk to people in city government, the school system, and businesses, corporations in town. Today we're featuring the Four Cities Compact Diversified Medical Technology. Amanda Reid is an instructor, and she has been with us before a couple years ago. Amanda, you have three ladies here in your program. Could you introduce them next to you, and then we'll go down the line?
Sure. All three of them are seniors in our program. So this is Alessandra Balana, Kiara Boswell, and Dykes.
Okay, all right, very good. And how long have you been involved in this program?
This is my third year teaching.
Right, and you learn probably from the students something every year?
Yes.
You add things to the program?
Right.
No question about it. How about COVID-19? You talk about problems and concerns for teachers all over the United States. How did you deal with COVID-19?
So we started our program 3 years ago. So that came, at the tail end of the pandemic. When we first started this program, we had some limitations on being able to take students into the hospital. They had to be COVID vaccinated in order to go and do some of the shadowing. Since then, those restrictions have been lifted, so now that's not a requirement, which is nice. I'm able to get a lot more students to the hospital now than I used to when we first started.
In your program, are there opportunities for young people to secure jobs and be in healthcare?
Absolutely. So a lot of healthcare facilities don't hire until age 18. So my seniors now are kind of just starting to be able to be exposed to some of those opportunities. But our goal, in the Four Cities Compact is always to prepare students as much as possible for the workforce, whether they can enter that during high school or they'll be ready, as soon as they graduate, that they can go and enter the workforce. So some are starting to work in some healthcare facilities. I have some working in like some local extended care facilities, but certainly more opportunities will be available to them after they graduate and or turn 18.
Ace, why don't we turn to you? How did you first hear about the program?
I first heard about it through the Compact Showcase, which is where they will show sophomores like all the different compacts that are available to them. And I settled on this one because they offer a lot of like healthcare, like knowledge in general, as opposed to like specifically one career. And I thought that was very interesting, and I wanted to pursue that program. Yeah,
it really is a kind of smorgasbord of a lot of different things, and you can, try one out. If it doesn't work, maybe go somewhere else. And in healthcare, it seems like a lot of changes, a lot of people coming and going. What about your parents? Were they and grandparents? Were they on board with your decision?
Yes, both of my parents are nurses, so they were very supportive. And my grandmother used to be a doctor before she retired, so she was very supportive of this as well.
Well, we have certainly a commonality. My mom was a nurse for years and years at Worcester Community Hospital, and then she served at Apple Creek State Hospital for a while. And so, whenever a nurse comes or we hear about nurses, I get very excited. And nurses really perform a lot of activities and help people a great deal. Did you always feel that you wanted to kind of go in those footsteps and help people?
Yes, I think I've always been exposed to like the healthcare field through my family, and it's always something I've wanted to pursue.
Amanda, how do you get word out for maybe the middle school students? We had the 10th grade information, but maybe students wanted to hear maybe before that. How do you get word out?
Sure. Well, honestly, my best advertiser is these guys right here,
okay,
right?
Sure,
they tell other students, what they like about the program and some of the things they're doing, and that word of mouth really is the best. But we do some outreach opportunities to reach out to the younger students, like Ace mentioned, the Compact Showcase we do every year. That's geared towards the 10th graders, where every Four Cities Compact program sets up a table so they can explore all their options, because most of those programs do start the junior year. But we also do some middle school and elementary school activities. It's kind of a win-win in my opinion. It gives my students the opportunity to interact with younger students, but it also introduces those younger students to our program. So we do some elementary school visits. They've gone this year and taught the elementary level kids, about proper hand washing. We have a couple career fairs we're going to participate in. We're going to Copley Middle School here in a couple weeks. A group of them will go and highlight our program and talk about healthcare careers there. We do one at the elementary level in Wadsworth. They do a career day for the fourth graders that we're going to participate in as well. And certainly if any other opportunities come up, we usually take advantage of those.
It's really important for your students to articulate what they're going to be doing, and certainly bringing it down to the level of elementary or middle school students. That would be a little challenge, but I'm sure they did very well.
Yeah, we try and take some fun hands-on things for the kids, to play with, because that usually piques their interest too. So.
What about not to pick on you or anyone else, we need more boys in these programs, don't we?
We do. I've had a couple boys over the course of my 3 years, but certainly we're always looking to attract more.
Okay. Why do you think they're reluctant to get in? They think it's anyone can do it, or they have skills, they'd rather drive a bulldozer or something?
Yeah, it could be. I'm not sure. I mean, in general, we do have a lot of men working in healthcare, a lot of male nurses and males in other career fields. So I'm not sure what the answer is to convince the younger generation of those opportunities, but certainly, when we have those career fairs and different opportunities to showcase our program to younger students, we're certainly trying to, recruit people of, all genders and demographics. So.
Yeah, my mom, again, maybe your mom too would appreciate this. She liked to work with, especially when some of the patients didn't want to follow procedures and got a little antsy, but she really enjoyed working with male nurses. What about advancement? If you place these students and they get a entry-level job, is there opportunity if they show their mettle and do a good job to advance?
Absolutely, and a lot of healthcare facilities are now offering like tuition reimbursement.
Pardon me?
Tuition reimbursement. They will pay for you to go to school. Some places, like Akron Children's, for example, they'll just pay for your schooling up front if you're there working like in an entry-level position. So there's a lot of opportunity to get in with a good facility, and we have a lot of them in our area, that they will help you pay for some, if not all, of your education. Wow,
that just shows that there is really a need in this area. Miss Boswell, right? Kiara. Why is it important to have a positive attitude when you're working with a patient?
I feel like it's always good to have a positive attitude when dealing with anyone, especially if they're like in a hospital setting, because they're already in like an uncomfortable state. And so like when you see them, you want to create a positive vibe to make them feel more comfortable in like a unfortunate situation they're already in.
Yeah, they're there and they don't know what's going to happen next.
They're scared,
they're
nervous.
taking X-rays or something else, and they have a pain or something. There's reasons why they're there, but yeah, I think you have some really good tips to go ahead and put them at ease. Do you learn from other students, and especially from your instructor?
Yes, absolutely. A lot of the things like from last year, most of us, if we didn't know, like we obviously didn't know like a lot of the medical field, and so we were coming in like brand new, so we obviously learned a lot from our instructor. And then if like we had a bigger class than she usually has, we have like around 15 students, and so a lot of like a group of us didn't know how to do something, the other group might know how to do it, and so we learned a lot like off each other. So
yeah, it really I remember my mom saying, especially working at Apple Creek State Institute, a lot of new medications. There was, she would say, well, this month there was 2 new medications, and I had to be schooled on how much to give and when. And nurses, like teachers, like attorneys, are learning every day, aren't you?
Yeah.
Where do you think you'll be in 5 years?
I'm planning on getting my master's degree, so I'll be freshly graduated from my bachelor's I'll have a major in biology, and then I'm hoping to get my master's so then I can be an anesthesiologist, like assistant.
That's really good. They really are specialists, and they really do a wonderful job. I've had some dealings with anesthesiologists. What comments do you get when you take the students in from maybe the hospitals or the employees working?
We get a lot of positive feedback. The students usually are really eager to learn and excited to be there. They ask good questions. So we have a good relationship with, some community partners, with Summa Health System, with the Suprema Senior Center, and mostly good feedback.
What about the situation where do you place seniors, or do you kind of go in groups? I heard you mention before you had some people go to the hospital and other people do other things.
Yeah, so mostly we are traveling as a group because like I mentioned, a lot of healthcare facilities, it's hard to place them in jobs because many do require them to be 18 and graduated. But we do have the opportunity to shadow at Summa Health System at the Barberton campus. We go over there every week and the students rotate through a variety of departments there, and they get to shadow basically like what a day in the life is like for caregivers in a variety of positions. And then we have other partners, like I said, we work with the Suprema Senior Center where the students get to go and provide some health screenings over there. So that's another opportunity for them to practice and learn their skills and work on their communication and interaction with the public. So we do some field trips throughout the year. We've visited some of the local colleges to learn about their healthcare programs. We go out and visit the Wadsworth Airport and learn about the Cleveland Clinic medical helicopter that's out there. So a lot of different opportunities, but usually we're traveling as a group.
So really it's a situation where they're learning every day something new, and then through repetition, if you're giving blood pressure to the seniors or weighing them or whatever, you get pretty accurate after a while, don't you?
Right, that's the hope.
Yeah, you don't really want to do something. What about competition? I know high schools have a lot of competitions, especially in the Four Cities Compact. Is there one for your program?
There is. We compete in a national program. It's called Skills USA, and they do competitions for career tech students where they get the opportunity to showcase their skills. So we actually just had a group of 7 of my seniors competed at the Northeast Ohio Regional competition. Of my 7 competitors, 3 of them finished in the top 10 for their competition, so I was really proud of that. And I do have 2 that are going to compete at the state level next month. So.
Well, that has to make you feel really good that the items and the focus that you're teaching really came through and the students remembered and did it and could perform those activities.
Yeah. Last year, actually, one of my students took gold for the whole state in phlebotomy, so it was a really cool experience.
What's phlebotomy?
Phlebotomy, drawing blood, yes.
Oh, okay. Well, yeah. I know a lot of nurses that should go through that program.
Yeah.
I go through get that done a lot, and it's not exact sometimes.
Well, you should come see these girls. They're fantastic at it. So my seniors learn how to draw blood. They all have to draw blood successfully at least 30 times in order to take their certification test. So, and all 3 of these girls here have done at least 30 blood draws successfully, and they do a great job.
Since you talked about that, Ace, I'll hand you this. I was at the at the Suprema Center, and you were there. And that's where I talked to your teacher, set this up. How's my blood pressure?
Your blood pressure is pretty good. It's a little higher than average.
Okay.
Oh no!
But I think it's still pretty good.
What exactly is it? I forget.
It is. You have 126/72.
Okay. All right. And a good service you provide for the senior citizens, and I don't know how many took advantage of that, but it was really good, and it's certainly something that they will remember, and it's constantly change. You need to do that on a regular basis, don't you?
Right.
No question about it. Alessandra, what prompted you to get in this program?
Well, I knew I wanted to do something in healthcare, but I wasn't exactly set on something. This program really introduces us to so many different careers in healthcare, and it's really cool. Through it, I was able to figure out what I wanted to do or go to school for.
And what's that?
I want to become a pediatric registered nurse.
Okay, yeah, that's really very, very important, and we have a lot of concerns with students early on with finding things early. That's the key, right? If you get to the point where you know what someone has, that's really treatable, isn't it, after that? I'm really impressed with the program. You have such a variety of things you do, isn't that correct? So you could really pick and choose if something really you like, you can get into. If something isn't quite down your alley, you can bypass that and go to something else, right? No question about it. What about things for people to do? Suggestions that you have? I'm sure pediatricians would tell young people to eat, regular meals and eat healthy, chips and pop, and too much of that is probably not very good. What suggestions would you have for people watching the show to stay healthy?
Well, definitely dieting is always a good thing. Trying to get as much physical activity as you can. This could just be going for a walk or, deciding to take the stairs instead of the elevator. And not only physical, but mental health wise too. Putting yourself out there socially can help with your mental health.
Like reading and visiting other people.
Yep, exactly.
That's really, really important. We're really lucky to have a lot of rehab facilities and hospitals and the like in our area that are really nationally renowned, aren't we?
Yeah, we are. Like Ms. Reid said, we're very fortunate to be with SUMA and be able to go to the hospital and shadow in every department and see what they
No question about it. And they take care of people in all sorts of various areas. I mean, it's not just people that maybe have trouble with COVID. Certainly, people that have overextend with shoveling snow. That really seems to be seasonal. People know when that happens because we got the first snowfall and they overdo it. Do you think you made the right decision to get into diversified medical technology?
Definitely. I don't regret it at all. I've had many different things that I thought about going into, so it gave me a chance to really be set on one that I knew I was going to like.
And not only that, and opportunities. It sounds like Amanda has told us that there are opportunities galore in this field, and if you have the right attitude, you really can go far and really advance in this. Amanda, what about if the girls aren't feeling good? If they have a cold or sniffles, do you want them in your classroom?
Certainly, we want to be mindful of not sharing germs, right? And we're more mindful of that now, post-COVID, than I think we ever were. But especially when we're going to places like the hospital and the senior center where we're interacting with patients whose immune system might not already be, working at peak level, we certainly don't want to be the person who's bringing some germs and exposing those to those patients. So we certainly ask, especially in those situations, if they're not feeling well, to stay back from those opportunities.
Yeah, I didn't think about that. I thought maybe getting you ill or the rest of the class.
Well, yeah.
But you are going and interacting on a regular basis, and they are susceptible. They don't have. They're not healthy. That's why they're in the various positions they're in. What about any support from the Four Cities Compact? Have you gotten all the support and resources that you need? How about looking down the road? Is there anything that you might desire for the years to come?
Oh, absolutely. The Four Cities Compact and Wadsworth City Schools are really supportive of my program. Coming in, with a blank slate 3 years ago, I've had a lot of support to build that program up and to get the equipment that we need. As well as we had some donations. SUMA has donated some used equipment that they weren't using anymore, which we greatly appreciate. We have some beds that Cleveland Clinic had donated as well. So certainly I always have a wish list. We want to stay current with trends, and I'm always looking for new opportunities that I can present to the students. So one new thing we added this year is they're learning about EKGs. I haven't introduced that topic in the past, but we've been able to add that. So I would love an EKG machine. That costs a lot of money. So it's not in the budget quite yet. But Wadsworth Fire Department actually gave me a couple of EKG lead sets that they didn't need anymore. So we're still going to be able to give the students some hands-on practice with that. So I try and tap into some of those resources that I have, and then certainly get creative with others. If we can't have the actual piece of equipment, we'll try and simulate it or at least talk about it as much as we can.
So it sounds like you aren't in a bushel basket. Putting it over, you really reach out, and EMS is certainly there. We did a show on the new fire station down on College, and it was very educational for me and for our guests, we hope. And really, they really need to be up on medications and how to keep people stable to get them to the hospital. And it's a really difficult position to be in as well.
Absolutely.
And the other hospitals you reach out to, that's you seems like you have your hands out and you take any item or machine that will enhance the program.
Exactly. The worst they can tell me is no. So I'm not afraid to ask.
Ace, what's looking down the road for you? It sounds like you have parents that are really involved in healthcare, and you really believe in healthcare. Where will you maybe be down the road? What's the next few months going to turn out for you?
Well, I am going to Ohio State for biology and pre-med, and then after that I hope to get into medical school to become a physician.
Wow, those are very high goals. It's really it's not something that happens overnight. It's not like a month or two situation. It's long term. And have you had these dreams and aspirations for a while?
Yes, I've always wanted to be in healthcare, and especially pursue being a doctor of medicine in healthcare.
Would you concentrate on pediatrics for young people, or just general health?
I think I want to concentrate on neurology specifically.
Wow, those are very, very, very high goals. And you, young lady, Ms. Boswell?
I want to be the anesthesia assistant.
Yeah, right.
Yeah.
Right.
So, like, within a couple of months, I'm going to Kent. So that's going to be exciting, and majoring in biology. Me and Alessandra are actually going to be roommates.
Okay.
So we're going to continue our medical education together and help study and stuff.
Well, that's really good to have a study group. I mean, it really, because sometimes those classes, they sometimes weed out students that aren't really serious, and they really do make it very difficult for you to stay in that program. That's very, very good to hear. Kent State, yeah.
Yep.
So you won't go too far away from home. And
Yeah.
Columbus isn't that far as well. Glad we're staying in the Buckeye State. And Alessandra, what do you also want to be in the same area, in the same field as your friend?
Well, I want to go into nursing, and I'll be going to Kent State for that.
Yeah.
So I'm really excited. It's a new chapter.
Nursing's changed a lot over the years, hasn't it? It really seems like the nurse has more responsibilities than ever before. Before, they kind of relied on the doctor a lot to give medications and orders. And now the nurse has to take things into advisement, do things on her own, right?
Mm-hmm. Yes.
Is that okay with you? You know, within limits, of course.
Yeah. Definitely the nurses are with the patient a lot. Mm-hmm. They're really responsible for a lot of things. But yeah, I'm excited. Not too worried.
And nursing now, finally, we've got some wages and salaries to come up a little bit. Before, you might say that they were stagnant for years. What about that? Do you think that salaries are important to draw new people in?
Oh, absolutely. And we do have a lot of healthcare facilities in our area, which does work to the advantage of the employees because they have to stay, competitive with each other to attract good employees. And so we are very fortunate in this area to have the healthcare systems that we have. And they do, they pay really well. I think the last number I saw, the median salary for a registered nurse is right now around $86,000 a year. So it's a good living. Yeah,
it is, but a lot of duties and responsibilities, and certainly, through weather like this and ice and snow. I mean, if the nurse isn't there, then someone else has to pick up the slack, and that's not always easy to do. It's certainly an interesting job, and one that is. You can't predict, right?
That's right.
It's really something that a patient may be doing well, but something happens and they're not. Or, you might suggest, maybe exercise or better diet, and they listen to you, and they get better suddenly. So it's really difficult and also not predictable.
Right, and can be really rewarding too.
Very, very much so, very much so. And I'm sure, ladies, you may also see some younger students that you may say, hey, you might try diversified medical technology. And I like it because you just don't get honed into one area. I mean, it seems like there's a diversity, isn't there?
Yeah, definitely. I feel like it has a lot of opportunities because we learn like so much about so many different like positions and like fields we can go into.
Yeah, yeah, and background to kind of appreciate other individuals in the facility or hospital you're working in. I think that would be quite an advantage, and you would kind of work so well together in that situation. What about the number of jobs that you guys can that's really amazing. I mean, it's just unbelievable how many things you can really do in a 2-year program.
Mm-hmm.
Can you comment on that? I mean, it's just mind-boggling how many different array of things you can get into, and you may want to get in a certain area, but someone else may guide you into another situation.
Mm-hmm. One thing I hear from everyone that I tell, like, I'm going to go into medical, is that's the best field to be in because there's always so many opportunities. And then, like, a great thing about our program is that we get, like, a lot of certifications. So even if you don't know exactly what you want to do, a lot of the certifications will apply to other, like, no matter what department you want to be in. So, like, we get first aid, we get, like, CPR, stop the bleed, OSHA, MedTerm. So, like, a lot of that just applies to a lot of, like, broad around the medical field.
A lot of good background materials, and certificates don't really help you along the way, no question about it, as you get your position. Mm-hmm. Ladies, Amanda Reid, I've really learned a great deal about nursing. I really appreciated nurses before you came in, and certainly a lot of fields that have a lot of opportunities. Thanks for viewing Bruce on the Loose, and we'll be in next week with another exciting show. Thank you.
You are watching WCTV, Wadsworth Community Television.